Hello and welcome to the Machinists News Network. I'm Deirdre Kanievsky. From the politicians in Washington to the family next door, everyone seems to be concerned with health care costs. And with a presidential election less than 2 years away, you're going to hear even more on the subject. Before any candidate announced a potential bid for the presidency, all of them were already talking about health care.
We will never be able to provide health care to the American people. We will never get this health care system under control unless we actually have the backbone to take on the big drug companies, take on the big insurance companies, take on the big HMOs.
It's one of the biggest problems I hear about as I travel through New York. How can small businesses afford health care? And we have legislation that is modeled on the Federal Employee Health Benefits Plan.
But it's wrong. Wrong when businesses have to lay off one employee because they can't afford health care for the rest. It's wrong when a parent can't take a sick child to the doctor because they can't afford the bill that comes with it. It's wrong when 46 million Americans have no health care at all in a country that spends more on health care than any nation on earth. It's wrong.
Lots of issues surround the health care debate as the numbers continue to rise. Family health care premiums are up more than 87%, growing 5 times faster than worker wages. Deductibles are up 50%, and co-pays and prescriptions are through the roof. Because of the 46 million uninsured, Americans pay 15 million more in taxes. But while everyone seems to be developing their own solution, organized labor is working on step 1, protecting workers and their jobs, because that's where most Americans get their coverage.
For the last 65 years, business has been the backbone of our health care delivery system for working Americans. 175 million Americans today get their health care through their place of employment. That represents today a roughly 61% of all American workers.
Small business owner Sheila Ogle knows health care is the lifeblood of her 25 employees.
Providing health care benefits for my employees is something that I believe in and something that I believe that I should do and that every business owner should take the responsibility to do.
But even if you have a boss like Sheila, no one is completely out of harm's way.
We always say employers not going to drop coverage. A large employer is not going to drop coverage. It only takes one. It only takes one large employer to make a major move in order for us to see a large herd right behind that employer.
This is where having a union contract helps. Because while businesses look for ways to cut costs by dropping items like dependent dental and eye care, organized labor is working to stop this from happening. Unless you have a union contract, businesses don't have to offer health care. Analysts warn this is a critical time.
There's no federal law that requires employers to offer these benefits. They do so because they believe it helps them recruit and retain workers, and they also believe it helps with the health status of their employees, ultimately the productivity of their employees, and their bottom line.
Many businesses are coming up with creative ways to cut health care costs. Some promote wellness programs. Larger companies are taking this a step further.
They developed a spine clinic right there on site where employees could go get a workup and have physical therapy. And they found that this decreased the amount of time it took for their employees to get treatment, and that it also lessened, along with helping their pain, it also lessened anxiety and other problems associated with the lower back pain.
Lessening the pains of workers is what organized labor is all about, and healthcare is no different. Good jobs need to come with good healthcare, and both need protecting. For more Machinist news, you can log on to goiam.org. Thanks for watching.